Phobia. Phobia are a type of anxiety disorder characterized by an excessive and irrational fear of specific objects, situations, or activities. People with phobias often go to great lengths to avoid the feared stimulus, and the fear can significantly interfere with their daily lives. Phobias can be classified into three main categories based on the nature of the feared stimulus: specific phobia, social phobia, agoraphobia. Specific phobia. Descriptions: specific phobias involve intense and irrational fears of specific objects, situations, or activities. Examples: common specific phobias include fear of flying, aviophobia, fear of heights, acrophobia, fear of spiders, arachnophobia, fear of needles, trypanophobia, and fear of public speaking, glossophobia. Impact: these phobias can significantly disrupt a person's daily life, leading to avoidance behavior and anxiety when confronted with the feared stimulus. Social phobia, social anxiety disorder. Description: social phobia involves an intense fear of social situations and a fear of being scrutinized, judged, or embarrassed by others. Examples: fear of public speaking, fear of eating or drinking in public, fear of using public restrooms, and fear of social interactions in general. Impact: people with social phobia may avoid social situations or endure them with intense anxiety, often leading to feelings of isolation and impairment in occupational or social functioning. Agoraphobia. Description: agoraphobia is characterized by a fear of situations or places where escape might be difficult or help might not be available in the event of a panic attack or other emergency. Examples: fear of crowded places, fear of using public transportation, fear of open spaces, and fear of being outside the home alone. Impact: agoraphobia can lead to significant avoidance of certain places and can result in individuals becoming housebound. It often coexists with panic disorder. Causes of phobia. Genetics and family history. There is evidence to suggest a genetic predisposition to anxiety disorders, including phobias. If someone in your family has a phobia, you may be more likely to develop one as well. Brain structure and chemistry. Differences in brain structure and neurotransmitter levels may contribute to the development of phobias. Imbalances in serotonin, a neurotransmitter that regulates mood, may be involved traumatic experiences. Phobias can develop as a result of a traumatic experience related to the feared object or situation. For example, a person who experienced a dog bite as a child might develop a phobia of dogs. Learned behavior, observing and learning from the fearful reactions of others, can contribute to the development of phobias. If a child sees a parent reacting fearfully to a specific object or situation, they may learn to fear it as well. Symptoms of phobia. Intense fear. The primary symptom of a phobia is an intense and irrational fear of a specific object or situation. Avoidance behavior. Individuals with phobias often go to great lengths to avoid the feared stimulus. This can interfere with their daily functioning and limit their activities. Physical symptoms. Exposure to the phobic stimulus can trigger physical symptoms such as rapid heartbeat, sweating, trembling, nausea, dizziness, and difficulty breathing. Psychological distress. The fear experienced by individuals with phobias can lead to significant psychological distress, including feelings of panic, anxiety, and a sense of impending doom. Cognitive behavioral therapy, CBT, CBTC, is often considered the most effective treatment for phobias. It involves identifying and challenging irrational thoughts and beliefs about the feared stimulus, gradually exposing the individual to the phobia in a controlled manner, exposure therapy, and teaching relaxation techniques. Medication. In some cases, medications such as selective serotonin, reuptake inhibitors, or benzodiazepines may be prescribed to help manage symptoms. However, medication is usually not the first-line treatment and is often used in conjunction with therapy. Systematic desensitization. This is a type of exposure therapy that involves gradually and systematically exposing the individual to the feared object or situation, starting with less anxiety-provoking aspects and progressing to more challenging ones. Mindfulness and relaxation techniques such as deep breathing, meditation, and progressive muscle relaxation can help individuals manage anxiety and stress associated with phobia.